Lahti University of Applied Sciences master's degree is created to answer the challenges of today's working life. The continuously changing working life requires experts who have a new way of thinking in managing, developing, and leading. A big reformation within Finland's social and healthcare is taking place. The reformation is needed because of the growing demand of services among the aging population, the wide variety of illnesses, and wider possibilities of treatments, along with greater expectations from the population, creating pressure on increasing costs. Also, slow economic growth and a high total tax rate by international standards are an impetus for finding new ways to curb rising costs. There are also inequalities among different areas and groups. The majority of the people live in southern Finland where services are available. People are also living in the northern part of Finland where hospitals and healthcare centers can be situated far away from inhabitants. People who are living there should be entitled to get the same services. Digitalisation has a big role in this accessibility of treatment. The aim of the healthcare and social welfare reformation package is to narrow down disparities in healthcare and to manage costs. The reformation will be implemented by integrating services and by strengthening the financial carrying capacity of service organizers. In Finland, there are two ways to achieve the master's degree. You can study first in high school and then go to university to get the master's degree. You also have the opportunity to study in vocational school and after that work and apply to a university of applied sciences. When you have enough work experience, you can apply to study the master's degree in a university of applied sciences like we did. One keyword of this reformation is digitalization, and that's why we are studying in this program.
My name is Marika Norta and I'm working in Family Center Viisikko as a director.
My name is Heikki. I work as a nurse in emergency department.
Hi, my name is Tarja and I used to work as a nurse in pediatric ward. I have also worked in ambulance. Nowadays I worked as an application specialist in IT company.
We want to stay in tune with what's happening within the social and healthcare today and tomorrow. We want to be a part of those who are making the reformation.
I started to study in this education because I wanted to get new experience about international working.
I applied to this education because I wanted to develop myself and also because digitalization is the future of healthcare.
I start my studies because I wanted to reform my practices and learn new things. I choose the digitalization and business know-how. And digitalization enables the development of future leadership and new ways of working. Operate close to the customers is very important, and I think that digitalization is one of the means of achieving it.
I applied to study this education because I wanted to challenge myself and learn new ways to work. I work as an application specialist in IT company and hospitals are one of our biggest customers. We must be able to provide them the newest information about digitalization in healthcare and also think about what it costs. Digitalization is the keyword of today.
I applied to this master's degree because I wanted to gain more knowledge for creating new digital services in healthcare.
The master's degree includes 90 credits. 30 credits are obligatory, for example, the beneficial use of digitalization in citizen services. 30 are optional studies, and 30 credits we get when we do our thesis. For example, of optional studies, part of us have chosen to take an intensive course of human resources and knowledge management in the University of Prague. Our thesis subjects derive from the needs of working life. The thesis must be implemented in working life straight away. We do our thesis for our own working places concerning digitalization in healthcare. It must deal with something new and it has to improve and enhance working life. We all come from working life and have different kind of careers. During our studies, some of us have already started working in new places even though we haven't finished our exam yet.
I'm also interested in service design, and during my studies I was offered a new job. This new position, one of my responsibilities include development of a new digital system for the company that I work for.
During my school I have got already a new work, and I'm doing my thesis to this new company, and title of my thesis is Production's Plan to our company's new robotic.
The subject of my thesis is to produce a new model for evaluating emergency patients.
We study using different kind of methods. We work usually as a team and do small development projects for companies. For example, we have had digitalization and healthcare theme days in hospitals for professionals. We told them about new technologies, new electronic patient information, national projects about how people can be part of the healthcare system. We were also at a mall meeting citizens and told them about the National Patient Data Archive and how citizens can use their freedom to choose treatment and have an influence on where to be treated. We have now studied almost a year and learned a lot about digitalization and business management. The studies have provided us with a businessman-like way of thinking. This sort of thinking would be necessary for the public sector in Finland. We say yes to digitalization and new technologies, but still we care. The most important people in digitalization and healthcare are the people receiving care. Life is all about learning, and we keep on learning.